30 years ago, I was a homemaker and mother and planned to do that for the rest of my life. However, my daughter had chronic bladder infections, and the doctor that was treating her actually put her on 2 psychiatric drugs for their side effects on the bladder. And while I questioned it and wondered why he would do that, his explanation was simply, she has to do this, you have to do this, or she's never going to get well. So as a young mother who, didn't know any better and not a physician, and trusting that doctor, I put her on the psychiatric drugs. It was Valium and Tofranil, which is an antidepressant. Well, not long after that, she was on them maybe close to 6 months, and I had noticed when she missed a dose, she had some strange behaviors. And this was not a child who had any behavior problems. When I mentioned this to the doctor, he just said, well, just stop the drugs. And he implied, just stop them cold turkey. And I did, and sent my child into a downspin that she really did not recover from for 3 years. And she became really deathly ill. And in my search to get her well, I went to many, many doctors, and finally found a doctor who called himself a medical detective, who really tried to find the underlying cause of the problem and fix it rather than just throw drugs at at symptoms. So this doctor impressed me so much. Not only did he help me get my daughter well, but I decided right then and there at the age of 39 to go to medical school myself to protect my family. And I felt like as a mother it was my job to do that, because if I didn't understand what doctors knew or didn't know, then something like this could happen to someone I loved again. And so at 39 I started medical school. And it was quite an experience going in to school with the perspective that I now had after what had happened to my daughter. I guess you could say I was a little cynical when we were taught so much about drugs and prescribing drugs, and I began to see the influence of the pharmaceutical companies on the students, on the doctors that were teaching us, and literally from then on in our medical careers, I saw this huge impact that the pharmaceutical companies had. Fortunately, my daughter got well, and as I started my practice, unfortunately, my mother was diagnosed with terminal lung cancer. And knowing now that medicine didn't have all the answers, I researched, and she received both conventional chemo and radiation, but also unconventional nutritional therapies and visualizations and hypnosis. And instead of being dead in 2 months, as was predicted, she was cured in 4 and lived 18 more years completely free of cancer. So I feel very fortunate to have gone to medical school and learned what doctors know and also what doctors don't know. As I got and opened my medical practice, I began seeing all these children being diagnosed as, and labeled as ADHD. And this was the early 90s, and this was the kind of when ADHD diagnosis really just exploded. The diagnosis had been accepted as the Americans for Disabilities Act accepted it as a real diagnosis at this point. So we began seeing literally millions of children being labeled ADHD and put on drugs like Ritalin. And so in my earlier experience with my daughter, I realized nobody was really looking for the cause of those symptoms, and they were just treating the symptoms. So I began focusing my practice on this ADHD population, working on finding the cause and fixing the problem, and had a great deal of success with that and still do. As time went on, though, I discovered that almost all of the mothers of these children who had been labeled ADHD were taking antidepressants. And as I queried them about, why are you on the antidepressants, what was going on, I got answers like, well, I was having back pain and the doctor put me on the antidepressant, or I went in because I had diarrhea and the doctor put me on the antidepressant. And this just blew my mind, because what I was seeing was, once again, doctors were just listening to a symptom and using a psychiatric drug to treat that symptom. And yes, many of them said they were depressed and they received the drug for that. So I began asking them, well, how long were you depressed? What was going on in your life? And so some of the answers were things like, well, I've been depressed since my last child was born, or I've been depressed since I was a teenager. And I started looking at those kinds of things and realizing, these people didn't have depression. They had real medical problems that were causing them to feel depressed. And once again, we wanted to find the underlying cause of those symptoms and fix them, so they didn't have a diagnosis of depression and they didn't have to take antidepressant medications. So that's when I started a book and wrote a book called Just Because You're Depressed Doesn't Mean You Have Depression.